Hello, everyone. Welcome back to the Career Guidance Series US. I hope you're all having a wonderful day. I'm honored to be your host for today. My name is Nida Mariam, and I'm the coordinator of Alfaisal MedHub under the International Office at Alfaisal University in Riyadh, Saudi Arabia. For those of you who don't know what Alfaisal MedHub is, it is an initiative under the umbrella of International Office at College of Medicine that aims at creating an online global community of medical students. And it covers a broad range of topics that are common to medical students all around the world. And our primary objective here at Al Faisal MedHub is to help students, medical students, learn more about their career opportunities that are available to them after graduating, as well as the steps that are involved in pursuing them. Since medical students are always confused about the path, that's ahead of them, Al Faisal Medhub's Career Guidance series addresses this challenge through the perspective of accomplished and experienced seniors. As you all are aware, we are now conducting the Career Guidance Series US for all medical students in partnership with AMBOSS. And our talk today focuses on the interview process and the post-interview pearls, which will be given by Dr. Khalid Jazieh. And Dr. Khalid is an Al Faisal University graduate. He completed his internal medicine residency at Cleveland Clinic and is currently the Chief Resident of Quality and Safety at the Cleveland VA Medical Center. So thank you for joining us today, Dr. Khalid. It is an honor to have you with us today. We sincerely appreciate your time and your efforts.
Thank you for having me. It's an honor to be here.
And thank you. You can start whenever you're ready. And before you'd like to start, I just want to make sure if you want to have the questions towards the end, or would you like to answer them as they come?
No, I think questions towards the end would be better.
Sure, that sounds good. You can start sharing your screen now.
No, okay. Okay. Can you see my screen like this?
Yes, you can see us.
Perfect. Okay. Thank you, Nida. Appreciate it. Thank you to everybody from the International Office for doing this. Assalamu alaikum, everyone. My name is Khalid Jazieh. I appreciate that really kind introduction, Nida. As mentioned, I am a graduate of Alfaisal, and it's always good to be talking to Alfaisal students and Alfaisal graduates. I am a graduate of the 4th class, which seems like such a long time ago now. And alhamdulillah, I matched at the Cleveland Clinic for Internal Medicine Residency, and I graduated in June of 2021, and I'm currently working as a chief resident and will be doing fellowship in HEMONC next year, inshallah. So just to what we'll talk about during the talk today, and this will inshallah be around an hour, maybe a little more than an hour talk, and then we'll leave the rest of the time for questions. So we will start with maximize how you can maximize your interviews after you submit your ERAS application, how you respond to invites, how some advice on scheduling interviews, how you prep for the interview. We'll talk a little bit about the pre-interview dinner and social event. We'll talk about the interview day and the differences between the virtual interviews and the in-person interviews, because it's not clear what the future is going to look like with regards to the COVID pandemic and the interview seasons coming up next year. Conduct, do's and don'ts. And then, of course, we'll talk about the most important thing, the actual interview itself and the common question asked and suggested answers for some of the common questions asked and how you can approach those, as well as questions you can ask yourself to the interviewers. How to assess programs and how programs assess you. That's very important for you to know and to keep in mind what you do after the interviews are done. And we'll briefly touch upon and like I said, we'll have questions at the end. Just a few important disclaimers that I'd like to start off with. This is all my personal perspective and my opinions and things that I've heard from trusted colleagues, friends, advisors. Different people have different perspectives. Different people have different opinions. A lot of people may agree with what I say. Some people may disagree with some of the opinions that I have, and that's fine. There is no one clear rule book to doing this, and things aren't set in stone. So it's very important to hear perspectives from other people as well, not just my perspective, but this is really, I think, what worked for me and what worked for people that I know. So I've been an interviewee as an applicant to both residency and fellowship, and I'm currently an interviewer for my program. So I've seen things from both sides of the table, so to speak. So I can give you that perspective, as an interviewee and as an interviewer. I will tell you though, things that I mentioned today will not be specific to my program. They will be generals. I'm not going to actually specifically talk about the intricacies of my residency program. Different programs will have different systems, different attitudes, different approaches to residency interviews. Some program directors like certain things that other program directors don't like. So again, like I said, there is nothing set in stone about this process. Get other perspectives, like I mentioned, and I will include recommended reading at the end and recommended references. And I have no financial conflicts to disclose. Unfortunately, I'm not famous enough yet. If anybody has any, deals that they'd like to make, I'm open, I'm all ears, but not yet. Now we'll start with the first thing. You've submitted your ERAS application, you filled it out, your personal statement, your CV, you submitted that to your programs. What do you do at this point? Well, really, you have to be patient, especially when you start off. You'll expect a week or two of silence, sometimes, 3 or 4 weeks, not really hearing much. Then you'll start getting a bunch of emails. Most of them will be automatic emails, things like, we've received your application and we are reviewing it, and you will hear back from us in the future. You will unfortunately receive a few rejections, and I think this is common just because, as international graduates, this is a very competitive process, and especially for international graduates, it's even more competitive, and a lot of programs will filter international graduates out very early on. So you expect quite a few rejections, and don't let that get you down. I'm not saying this to upset anybody or to disappoint anybody. I'm just saying this to kind of be prepared to get quite a few rejections, and especially when it happens early on, it's usually because programs are filtering applicants out based on whatever criteria they have. And then inshallah, you'll be getting some invites as well, to which you should respond to right away, and we'll talk about that. And how do you maximize your chances of getting interviews? Well, really, it starts with applying to more programs. The more programs you apply to, the higher the chances you'll get interviews. And this is, particularly important because, like I said, in my experience, I really think that a lot of programs filter out many international medical graduates, especially if they're coming from countries they don't have much experience with, or coming from a med school that the program hasn't had a resident from there before. They generally like to go with, things that they're more familiar with, more comfortable with. So a lot of programs are just going to filter people out straight from the start without even looking at their CV. So applying to more programs will maximize your chances of getting your application looked at. I can't speak about other specialties, but I know in internal medicine, a lot of international graduates will apply to 100 plus programs, 150 plus programs, 200 plus programs. And it's not unheard of. And I think, the more programs you apply to, the higher the chance you will get interviews. But always keep in mind that, if you know for certain that a program is not a place that you would like to interview at, or a place you'd like to match at for sure, and you would rather go unmatched than interview there or than work there as a resident, then don't apply to them. But otherwise, if it is a program you could see yourself working at, then really consider applying to it. Signal programs you have a high chance of interviewing at. This is something that's actually new. I didn't do this. This wasn't something that was going on during my interview season, but I know that this is something that's happening now with the supplementary application. And I would say, if I recall, I think you get the chance to signal 5 programs. I would advise that you signal programs you think you have a high chance of interviewing at, programs that have international graduates, programs that have graduates from your med school. I think that's probably the most important thing. You don't want to signal programs that don't take IMGs, that you really have very low chance of getting at. Don't waste the signals on those programs. I see a comment saying that the audio keeps disconnecting intermittently. Is this something that everybody's encountering, or are you guys hearing me well?
No, doctor, the audio is fine.
Okay, got it. It might have been just that person's connection. Sorry, Shamil, I think it's your connection. All right. And then reach out to programs to express interest. So I wouldn't do this, day one after the interview, or the application season starts. Give it some time. Again, people are not going to be reviewing applications on day one. It takes a few weeks just to go through, the applications. I can tell you my program got like close to 6,000 applications this year. So there's a lot of applications for programs to go through. So give them some time. Then afterwards, you can send emails or calls to express your interest clearly. I would suggest doing it to whatever contact email the program has on their website. But keep in mind that there's a low likelihood this will have much of an impact, especially emails. I haven't heard of people getting many invites from emails, and I will tell you, recruitment emails get slammed during interview season, like slammed. Hundreds of emails a day could potentially, like what we're talking about. So calls may have a higher chance of connecting and getting you an interview. I called quite a few programs. Most of them didn't answer. Some of them said that they weren't taking, expressions of interest, quote unquote. They weren't taking anybody's ID. But a few of them did take my ID, and I did end up getting an interview from them shortly afterwards. And I remember some of them, as I was talking to the coordinator, she'd open up my application and she'd like, "Oh, your application is really good. I'm surprised we haven't looked at it yet." And I'd get an invite the next day. And I think that really goes to show that they weren't looking at a lot of our applications as IMGs, especially as IMGs coming from Saudi Arabia and from a med school that's relatively fresh. But I will say now Alfaisal is gaining quite the reputation, alhamdulillah. So we've got graduates who are in a lot of programs across the country, and I think that's starting to show. Don't annoy people. Don't bother program leadership. Don't spam them with emails every day. Don't hammer call them 5 times a week. That's not your way of getting invited. If anything, that's going to actually hurt your chances of getting invited. Don't bother people. 1 or 2 emails during the season, a phone call, and then that's it. I wouldn't do much more beyond that. I don't think you're gonna improve your chances of getting an invite after that, and I think you're gonna just, if anything, you're gonna start annoying people. And let me see. Okay, be patient. Like as I mentioned, give it time. And traditionally, interviews would come in waves. And what I mean by this, especially when this was an in-person interview season, is the first wave would come between October to early November. They'd send out a bunch of invites, and then as the season continued, what would happen is a lot of the applicants who got quite a few interviews would start canceling their interviews later in the season. They would start canceling their December interviews, their January interviews, because if they've interviewed, at many programs and they like the programs they're interviewed at, they didn't want to pay for extra, travel funds and, have to book plane tickets and hotels. So it was very common for a second wave to come towards like the end of December, and programs would send out another wave of invites. And that's kind of what happened during my season when I applied. However, I think it's a little different during the virtual interview season because less people are canceling because there are no costs associated with that. And I've heard of applicants who have been interviewing at 20 plus programs, which I think is unfortunate because it deprives other applicants of their chances to interview at these programs. But it'll be interesting to see how this plays out during this season. So you've submitted your application, you've waited, and inshallah, a few weeks later, you start getting your email notifications, you start getting invites through your email. I would highly recommend that you change the ringtone or the notification tone of your email, particularly if you can do it for the ERAS email address, just so you know immediately when you get that email and you want to reply immediately. This is how an email may potentially look like. Good morning, you've been selected for an interview. These are the dates. Please, and then they'll give you instructions on how to schedule that interview. My advice would be to respond immediately and to schedule ASAP. I know people who waited an hour and lost the interview spot and had to be waitlisted. I know people who waited half an hour and lost the interview spot and had to be waitlisted. A lot of times programs will unfortunately send more invitations than they have slots, and they just first come first serve. So that's why it's very important to have that unique notification for your email and be able to quickly respond to these invites. And I recommend, so when it comes to actually scheduling, there's several ways of scheduling it. It depends, obviously the program will tell you how they want you to schedule the interview. A lot of them will do it via email. So you respond, this is how, a classic response email, dear so-and-so, thank you so much for your email. I'm honored to be invited to interview at your program. I would always recommend giving multiple options, at least 3 options, just in case the first one gets taken by the time you respond. And some of them would actually send like 10 dates and tell me to rank all the 10 dates that I wanted to interview at. So rank give them more options than less. That's always better. Other scheduling modalities that are available include scheduling through ERAS itself, and this is an example of how the ERAS calendar looks like. Some of them use third-party services like Thalamus or other websites, and these are all very intuitive services, very easy to use. So I know that most of you, who are applying this year have probably, at this point in the season, you've probably already got interviews, and you've probably already, maybe I know some of you have even had interviews, mashallah, which is great. So this is advice that's more relevant to this time frame now of the season is how do you prep for the interview day, and how to answer commonly asked questions on the interview day, and what to do after the interview. So first and foremost, I would recommend that you really know your application well. Know everything in your CV, know everything in your personal statement. Everything is fair game to be asked about. I can tell you one of my mistakes that I made during, well, not a mistake, but something that happened during my interview season was I was asked about an elective that I did, and this was during my fellowship recently, and it was an elective that I did as a medical student, and they asked me who I worked with during that elective at that cancer center. And my mind just blanked completely, and I completely forgot who I had worked with. I could remember everyone else that I had worked with on all my other electives except that one person I couldn't remember. And I mean, the interviewer was fine with it and like, it's okay. And I looked it up later and I sent them in an email, but it was a very awkward moment for me. So that one elective that I had done 4 or 5 years ago, they asked me about. So know everything in your application well. Be ready to talk about anything and everything in your application. If you mention one of your hobbies in your CV, be ready to talk a lot about that hobby. Something you mentioned in your personal statement, if the interviewer brings it up and you don't remember, that's not a good look. Of course, you want to review your interviewers well. You want to know who they are, what their role is in the program. Sometimes I'd look a little bit about what research they've done if they did research, just to kind of have a general idea of what they could, what we could potentially talk about. But I don't think that ever actually came up during the interview day where we ended up actually talking about the interviewer's job or their research. You definitely want to thoroughly review the program website, and things that you want to look for are basically what's important for you to know when you're assessing programs. I really think the residency alumni outcomes is one of the most important things for you to know about a program. Where do their residents go after they finish? What jobs are they getting? What fellowships are they getting into? Looking at how much research output they put out. All that I think is very important, objective information that helps you decide how well the program will help you get where you want to go. Look for things that they talk about their curriculum, their hands-on training, things that they have that are unique to their program. Very important for a lot of international students is the visas that are offered. Do they only offer J1, H1B? If you're interested in research or teaching medical students, then those are things you can look for on their website. Try to see if there's any hint as to what the resident community looks like. Do the residents have social events? What do they do outside the hospital? And importantly, you want to know about the city. You're going to be living there for 3 years. But not just that, a lot of people end up actually staying in the same city or in the same state or in the same kind of region, geographic region, after residency. So kind of picking a place that you know and like or want to stay at is nice. It's not the most important thing, I think, but it is something important to keep in mind. Now, you've scheduled the interview. Traditionally before COVID, we would have these pre-interview dinners that hopefully may come back at some point in the future. They were really fun. I really enjoyed them. I to this day, I remember which programs took us to fancy dinners and which ones took us to kind of really cheap dinners, and kind of tells you a little bit about my priorities and what I remember. But that I still remember quite a few of the pre-interview dinners that I did during my residency season. And again, there's not a lot of quote unquote rules for the pre-interview dinner. Just common important things that I'll tell you: be on time, be punctual, dress business casual. People ask if they need to dress up in a suit for this. Absolutely not. Dress business casual. Be friendly and relaxed, but don't be too unprofessional. And try to get a feel of the resident community and how they feel about the program. And this is very important. For the most part, the pre-interview dinner is not used to assess the applicants. This is really an opportunity for the applicants to assess the program, to talk to the residents. Typically, the pre-interview dinner does not involve the program directors, associate program directors. There's usually just a chief resident coordinating it, and then it's mostly mingling with the actual residents. And this is a great opportunity for you to ask residents questions that you would not ask a program director, or you would feel uncomfortable asking an interviewer. This could be about things like cost of living, what's the city like, are there moonlighting opportunities, or what do you like or not like about the program. This is really a casual, friendly, environment for you to ask these types of questions, and just to kind of see how the residents interact with each other. Do they seem comfortable with each other? Does it seem like they regularly get together outside the hospital, or are they awkward with each other and everybody's kind of doing their own thing? So I will say I did hear of a program that actually the residents do give feedback about the applicants they had dinner with, which is weird and very uncommon. I'm not saying it doesn't happen. It probably I've heard from people that their program does actually use the pre-interview dinner to assess applicants, but that's not really a good practice for that program. I really think this should be to help the applicants learn more about the program and assess the program. Have fun, but don't do anything crazy. And the reason why I say this is an important caveat is, every now and then it's not common, but every now and then there will be an applicant who, drinks a little too much, gets a little drunk, and starts acting a little loud, acting a little inappropriate, doing a little things, some crazy things. And I can tell you that will probably go back to the program leadership. Something like that, a red flag like that, making inappropriate comments, inshallah, this isn't a problem for anyone listening, but drinking too much and then being clearly drunk during the interview, the pre-interview dinner, those aren't good signs. And if something like that clearly, unusually negative happens, that will probably go back to program leadership, and that will be something that people will, warn the program leadership about. I can tell you, if there's a resident or an applicant in a pre-interview dinner who's making inappropriate comments with like some of the other female applicants, for example, that's definitely gonna be a big red flag, and that will definitely be brought back to program leadership. And that's the one clear way that I think it could affect people. But inshallah, again, this isn't something that any of you have to worry about, but just FYI. In the COVID season, we've been doing these pre-interview social hours through Zoom usually, and I think the same thing applies. Be on time, dress, business casual, have like a cup of coffee or a cup of tea or something to drink if you want. Talk to the applicants. It's a little hard to the residents. Sorry, it's a little harder to assess the resident dynamics, and it's not as comfortable as the pre-interview dinners. But you are saving on travel costs if it's a virtual thing. But really, it's the same rules apply here. Now we're going to talk about the actual interview day. You had the pre-interview social event. It went well. You like the residents. Things are going great. Now we come to the actual interview day. And again, because of the challenge of the pandemic, I don't know. The current interview season is entirely virtual, and we'll talk about the virtual do's and don'ts and things pertinent to the virtual interview day. But there's a good chance that I don't know what's going to happen next year. I know a lot of people really want to go back to the in-person interview days, and that may happen starting next year. But I also do know that a lot of people really like the convenience of the virtual season and the cost savings that come with it. I have to say is a big advantage. So I don't know if next year things are going to be in person, things are going to be virtual, if programs are going to offer both options. That I don't know, but we will talk about the in-person interviews as well, because that's the classic interviewing, modality, and that there's a good chance that may come back at some point in the future for any of our listeners who aren't interviewing this season. So, what to expect? On a virtual interview day, you want to check in 10 to 15 minutes before. You always want to make sure that you have backup plans for technological issues. You want to make sure your internet's working, your camera's working, your mic's working. So you log in about 10 to 15 minutes before. You don't want to log in half an hour before and be the only person, on the call for half an hour. After that, you can expect a program overview. This is usually about an hour and a half. Maybe sometimes it's a 2-hour talk about the program and what that entails, and what the training is like, what the schedule is like, what the benefits are like, a little bit about the city. What some programs have been doing, which I think is actually really nice, is they may pre-record the program overview and send that to you before through email, so then you can watch it at your own time, at home. And then during the actual interview day, they don't have this program overview. They just give you like a half an hour to chat with the program director or the chief residents and ask them whatever questions you have. So this may not actually be a full program overview during the interview day. They may actually give this to you before. Now, I really liked when the programs did that because it just saved us a lot of time. I did not like sitting for 8 hours in front of my computer on a virtual interview day, which did happen a few times. And then after that, there's usually some sort of meeting with residents on the interview day. And this is, again, for you to be able to talk with more residents, especially residents like during their work day, how their work is like, what their schedule is like. And finally, interviews, of course. And we'll talk about the different interview formats and what to expect. But this is how typically things go during the virtual interview day. And within the program overview, there's typically a virtual tour. Now, in person, things are a little different. You want to be there at least 30 minutes before at the hospital to find the right spot. I know people who actually would go the night before to the hospital just to kind of explore the hospital and know where they need to go. You don't want to come in late, and you want to make sure you know how to get where you need to go. They'll give you a program overview. This will usually be done by the program director. There'll be a talk usually by the chief residents as well, meetings with the residents and interviews. And then there's a tour of the hospital traditionally. And this was, to me, the most boring part. And it all became a blur, and I didn't remember anything from the tours of the hospitals by the end of the season. But it is, a part of the traditional interview day. And finally, there's usually always lunch. And again, just me being me, I still remember which programs gave us good lunches and which ones didn't. Again, that just my priorities. But they don't always happen in this order. Just to be clear, sometimes you may start the day off with interviews and then do the program overview. A lot of times the interviews are the last thing of the day. But these are just common things you can expect. Do's and don'ts. A lot of these are going to be similar between the virtual and the in-person interview days. Being punctual is extremely important. Almost every day on the interview trail, whether it was the virtual season or the in-person season, someone would log in late on Zoom, or someone would present like 20 minutes late to the hospital in person. It's a big red flag. Some people would forget that there was a difference in time zones, and there was an hour difference, and that's really not something you want happening to you. You really want to be punctual. I always say it's better to be an hour early than a minute late. You don't want to log in an hour early to a Zoom call, but really be 10 to 15 minutes early rather than being a minute late. Be engaged. And again, this is part of the new social etiquette that comes with the virtual interview season, is how to demonstrate that etiquette. I would say if someone's talking, like the program director's talking or the chief residents are talking, and all the other applicants have their cameras on, I think it's a good idea to have your camera on at that point. You don't want to look disengaged. It's still surprising, even in the virtual interview season, when we have cameras on people, on their faces, looking on their faces while the program director is talking, you'll see them looking away. You'll see them chatting with someone else. You'll see them like clearly on their, like I can see their phone on the camera. I don't know how people could make a mistake like this, but we literally have cameras on people and they're still not engaged, and they're still looking away and talking to other people and looking at their phone, which I really would not recommend. Mute your mic when you're not talking, because you don't want to disrupt the conference call. Dress professionally. You still want to dress like you would for an in-person interview. You don't want to dress too casually. I think having a good setup here goes a long way. You want a good camera. You want a good lighting. You want to have, something nice, or at least a plain background. You don't want some crazy stuff going on in your background. Dim lighting, a bad camera, it's just going to make for a bit of an unpleasant interview experience. And always have a backup plan for technological issues. Keep the phone number of the coordinator, and be ready to call them if anything happens. This happens almost every day. Someone loses their connection and then they call in and the program coordinator connects them to their interviewer that way. It happened regularly, almost literally every day. I don't think it will reflect negatively on you. In fact, if anything, if you're prepared and you have a backup plan that looks good, have your phone charged, make sure you have your computer charger if you're working from a laptop. Don't use bad internet. Go somewhere else if your home has bad internet. Don't use bad equipment. Really, during the interview season, during the virtual interview season, technology can make you or break you. In person, again, a lot of the same things. You want to be punctual. You don't want to be late. You want to be engaged and attentive. People would, in person, I still remember applicants would pull out their phones and do things while the program director was giving their program overview. Some of them would doze off during the program overview. You want to dress professionally. You don't want to dress too casually or too flashy. Be respectful of everyone I've heard the quote that, the interview starts the moment you walk into the city. I've heard of applicants meeting one of their interviewers or meeting the program director in the airport or on their way to the hospital, and like they see them, they meet them, they talk to them on the bus, for example, and then they actually see them in the interview day. So be respectful of everyone, which is, I mean, obviously good advice regardless, but don't be argumentative. Don't be, it's still, again, I'm just, the things that I see sometimes really surprise me. And I think anybody with common sense would recognize that these are problematic issues. I remember an applicant during the residency interview season who was arguing with the program coordinators about something on their schedule and like getting like pretty argumentative and rude with them during the interview day. It's like, might as well shoot yourself in the foot at that point. That's a good way to kill your chances of being ranked at that hospital. Another thing that I clearly remember, and this was also very surprising, was when the chief resident at one of the programs, one of the chief, we were doing a tour of the chief resident was giving us a tour of the hospital, and we had this applicant, bless her, I don't know what she was thinking, but she would just walk off away from the group to do her own thing and explore the hospital on herself. We lost her 2 or 3 times during the tour, and the chief resident would have to stop everybody, stop the middle of the talking, look around for this applicant, and actually leave us there and walk in the halls to try to find the applicant. This happened 2 or 3 times. And like the first time they told her, like, okay, this, please stick with us. Sorry we lost you. Stay with us. And then she did it like 2 times after that, which is, I don't know what she was thinking. I don't know what was going on, but common sense is common sense. If the chief resident's giving you a tour, don't walk around and start exploring the hospital yourself. Stick with the chief resident, stick with the group. Don't cause trouble for people. And don't get lost in the hospital and have, people come try to look for you and find you just because you couldn't stick with the group. And again, following instructions, don't ignore, don't doze off, stay focused, stay engaged, stay enthusiastic, show interest throughout the interview day, I think is very important advice. Last thing, having a travel checklist. I'm not going to go into too much detail about this. The references that I have in the end will have, more details about the travel checklist and things to take with you. I will say this is very important though. Keep a travel checklist. Go through it every time before you travel if you are going to have in-person interviews. It's very annoying to arrive at a place, come to your hotel at or your Airbnb at 7 p.m., unpack and realize you forgot your tie or you forgot your shoes. So like your professional shoes, not your sneakers. So have a travel checklist and go through it every time you pack. It's important. So now we're going to talk about the actual interview. And hopefully the goal of this is for you to, recognize that and realize that the interview isn't you getting beaten on by your interviewer. It's usually not a very high stakes, high stress situation. It's often very relaxed, very casual, and inshallah we'll discuss tools and tips and techniques for you to be able to handle the interview day confidently. I will start off by key advice that I think is very important for everybody to remember during their interview day. The most important thing to keep in mind is people will remember the impression you leave much, much more than they will remember the actual words that you say in your responses. And this is where your body language, your smile, your sense of humor, your positive attitude really makes the difference. I see people, and during the interview day or when I'm doing practice interviews with people, who it really seems like they've written down their responses and they're trying to memorize their answers word for word. And that's not the advice that I'd give people. What I would say is you want to really come across as natural, energetic, enthusiastic, positive. That's the impression you want to leave people with. I tell people, if by the end of the interview day I had fun with you and I feel like I would really want you to be with us on rounds, or I would want to be on a busy night shift working with you, and you're not the person who's going to be nagging and complaining about everything and dragging everybody down, but you're going to be that positive, upbeat person that we'd like to have with us. That's really the best outcome you can hope for after your interview. To get, again, I write this sometimes on some feedback about people that I interview. Sometimes is like I say 30 minutes wasn't enough. I really wish I had more time to talk to this applicant. I had a great time talking to them. And again, that's kind of the best outcome you could hope for, from your interview. Another important bit of advice that I would leave you with is you really have more control over the flow of the interview than you think, and the way you respond will direct your interviewer in a direction that will predict how the interview is going to go along. And we'll talk a little bit more about this. And the other important thing that, again, very, very important, is avoid red flags. You already meet their qualifications to be a resident on paper. They already have a positive impression of you. If you get invited to interview at a program, what that means is the program has already said, okay, based on your CV, based on your application, based on your letters, we think you have, on paper, you have the qualifications to be a resident with us. If you keep that positive impression and that positive outlook by the end of your interview, then you've done well. You've really done well, and there's a really good chance you're going to be ranked at their program. Obviously, if you impress them during the interview day, then that's going to improve your chances of being ranked higher. But more importantly than being the most impressive candidate is really just avoid red flags. Avoid, being on your phone when the program director is talking. Avoid being disrespectful. Avoid coming across as arrogant. Those are things. I think that the interview day, more than raising the ranks of certain candidates, I think what it really does is it helps show us people who look good on paper, but are actually very awkward in person, very disengaged in person, very disrespectful, very arrogant. So the interview actually will filter out people, but we filter out people based on these red flags. And that, I think, so just avoiding that in and of itself will be a big achievement, and will, I think, pretty much guarantee you will get ranked at the program you're interviewing at, because again, they already have a positive impression of you. Don't ruin that. That's the biggest on. Yes. Yes, Mohammed. The people on the phone, I mean, it did really tick me off. It's like I can see your phone on the camera when the program director is talking. Like, what? Like, come on. That's silly. I think it's silly more than anything else. And then the last thing that I would advise you is assess the program, and keep this in the back of your mind that this is a two-way street. We obviously, I think we as applicants, now I'm speaking from the applicant position, I think a lot of times we feel desperate that we want to match and we really want to get into this program and we want to do everything we can to impress them. But keep in mind that the program is also trying to impress the applicants, and the program is trying to give a good impression to the applicants as well. And you want to assess this program too, to see, if they have what you're looking for. And this is helpful for you in two ways. First of all, it helps you when it comes to ranking. Like, what you're looking for, you actually assess the program, and it helps you rank which programs you like more, which programs you like less. But I think the other really helpful thing that comes from this mentality is it gives you more confidence. It makes you feel more comfortable to ask questions. It makes you kind of recognize this program is now trying to impress me and is trying to sell me their program. And that helps you feel more confident, I think, when it comes to the interview day, which is really important. So different styles of interviewing, and the most common interviews that I had are, conversational interviews. These were the best interviews that I had, and they were my favorite, and luckily they were the most common interviews that I encountered. And these very often felt like a chat with a mentor. The interviewer would look at my CV and say, you know what, you've done great things, great CV. What are you looking for? Why are you interested in this? Why are you interested in oncology? What do you want in a program? What do you want to do after residency? And it really felt like I was talking to a mentor about my career, my goals, and my background. And I had fun with a lot of interviews. I still remember quite a few interviews that I had 4 years ago that I had a lot of fun with and that I really enjoyed. You'll have quite a few that are the classic, interview questioning. Tell me about your strengths. Tell me about your weaknesses. Tell me about a mistake you made. Ask me questions you have. This one was annoying, but I had a couple of these, and this was really, the interviewer would just come and say, hey, good application. What questions do you have about our program? And that was it. Like, the whole 20 to 30 minutes was me asking them questions and them answering my questions. So it's always good to have like 4 or 5 questions in the back of your mind to ask the programs, and we will talk more about good questions that you could ask. I personally felt the style of interviewing was lazy, but I came across it a couple of times, so it does happen. This is rare. Some interviewers, I think more old school interviewers, would grill, applicants with hard questions, poker face, one hard question after another, rapid fire, really just to kind of see not really caring much about your answers, but really caring about how do you maintain your composure? Do you lose confidence? Do you start getting anxious and nervous, and just seeing how well you handle the pressure. Asking medical questions, this is even rarer, I would say. I only had one interview during residency where where the program director actually asked me medical questions. It was like a USMLE Step 3 OSCE station. It was the program director pretended to be a patient with dizziness and asked me to take history and physical and like do a physical exam on him, which was very awkward. And traditionally speaking, this is considered a red flag about the program if they're asking you medical questions. Again, they have your transcript, they have your USMLE scores. I don't see the point of asking an applicant a medical question when you have 20 minutes to try to understand their personality and their attitude. Why you would ask them a medical question, to me, is just a waste of an interview. But it is out there. Just for reference, within our medical community, we call this pimping. Don't use this word outside the medical community because it has a very different meaning outside the medical community, and people will not understand what you're talking about, and they'll think you're talking about something inappropriate. And finally, unique interview styles. Panel interviews, I had one of these during residency, one of these during fellowship. This is when you are being interviewed alone with a group of interviewers. This is a little more nerve-wracking when it's in person and you're sitting at a table and there are 4 or 5 people, and you just kind of have to make sure you're looking to maintaining eye contact, with at different intervals with different people. It was a lot easier over Zoom, much easier looking at a computer screen instead of being surrounded by 5 or 6 docs. Group interviews are the opposite. It's when there is one interviewer and they're interviewing multiple people at the same time, 2 or 3 people at the same time. They ask each one of them a different question. I've heard reports of surgical programs actually leaving things like suture lines and things like that, and having applicants try out their hands-on skills, tying knots, tying sutures, doing all that stuff. I personally have never encountered anything like this in medicine. Surgical programs have their own style of doing things. I don't think this is very common though, but I have heard from applicants who are in programs where this actually happened, but I think it is quite rare, fortunately. Now we'll talk about the meat and the potatoes of this talk, which is what most people are waiting for: the commonly asked interview questions and how to approach these commonly asked interview questions. The first one, and by far my favorite one, is tell me about yourself. And I think that a lot of people don't like this question, which I think is unfortunate, because going back to my point about you controlling the flow of the interview, this question gives you the chance to really control the flow of the interview. And what I mean by that is, very often this would be the first question that people would ask me, and based on what I would answer, they would ask me more questions to elaborate on my answers. And I'll kind of elaborate on that a little more, but really I think this is a good opportunity for you to guide the interviewer to focus on things that you want to talk more about. And different people have different approaches. Some people say, don't talk about anything that's on your CV, only talk about personal things, only talk about your hobbies. Other people say, talk about your family and things like that. Personally, I didn't think that interviewers really cared that I'm like the oldest son of, a family with like a sister and 2 brothers, and, I have, this pet, and my dad's allergic to fur. I don't think that the interviewers would really cared much. And if I talked about something that they didn't care much about, I think that would open up the floor for them to start asking other questions and heading off in other directions. So what my personal approach is I would, and again, this is for most of my answers, I would focus on 3 points. And the 3 points that I would talk about would be, first of all, the first point that I would talk about would be my background. I'm Khalid. It's great to meet you. My name is Khalid. I was born in the States, but I grew up in, spent half my life in Saudi Arabia, and I did medical school in Saudi Arabia. And then so that's, a little bit about my background, where I'm coming from, what I'm doing now. I'm currently working as a research fellow in a tumor immunology lab, studying the impact of immunotherapy on cancer cells. And then what I plan on doing moving forward, and give them kind of like that, in broad strokes, the big picture. I'm really interested in internal medicine, and I'm applying to residency in internal medicine because I want to pursue a fellowship in oncology and become an academic oncologist. And I think that this was a really a good way for me in 2 minutes to kind of summarize the most important points about me and the most important things that I would like to talk more about with my interviewer, and give them just a general overview of who I am. And now they know where I'm coming from, what I'm currently doing, and what my goals are and what my plans are. I felt like this was the answer that worked best for me. Obviously, this again, tell me about yourself is really supposed to be a personal thing, so you decide how you want to approach it. Some people really like talking about their personal things, their hobbies, their family. They like talking about their culture. I know some people, really like talking about how often they moved when they were kids and then how that impacted them. But again, I don't think the interviewer will want to elaborate more on those points. I every now and then I would drop a personal touch about like, oh, and when I'm not working, I like, doing this, or I like fishing, or I like cooking, or things like that. But really, I focused on these 3 points, and that worked very well for me. And almost always afterwards, the questions were, these were the follow-up questions. Oh, that was very interesting. Background. How is it like to move from the U.S. to Saudi Arabia and now to move back to the U.S.? Or, what are the differences in medicine between the U.S. and between Saudi Arabia? Other things they'd ask me about my research. Your research sounds interesting. What cancer cells are you studying? What, immunotherapy agents are you studying? What are you doing in this immunology lab? And then finally, they'd ask me questions about, what are you looking for in an internal medicine residency? Why oncology? Why do you want to do oncology? So almost always, the rest of the interview would be about points that I answered in this "tell me about yourself" question. So that's what worked best for me. Obviously, you can tailor this to however, whatever suits you best. Again, very common. Why are you interested in this specialty? Why are you interested in internal medicine? Why are you interested in general surgery? Why are you interested in radiology? You should be able to talk enthusiastically about the specialty. You want to really make it clear that you're passionate. You don't want to, come across as very flat and, almost like someone's asking you with a gun to your head, like, oh, I like surgery because I like cutting people open. And I like, that's not going to impress anybody. You really want to show enthusiasm here. And again, for me, I would pick 3 points and talk about those 3 points. I really like that personal interaction with patients and their families. I really love the holistic approach to patients and trying to manage patients as a whole rather than just focusing on one specific problem. And I love the diagnostic challenge of kind of coming up with differential diagnoses and trying to figure out really what's going on with the patient. 3 points. I felt like anything beyond that, you're just going to start boring the interviewer. Again, if you're talking about, surgery, you want to talk about, you like the fact that it's hands-on, you like doing procedures, you like being in the OR, you want to, again, seem passionate about it, you love the fact that you don't get any sleep, you hate sleep, that's great. Pathology, radiology, you can talk about how you enjoy looking at slides or images to make diagnoses, you like correlating findings with clinical presentations, using technology in medicine. All these are good talking points, and the resources that I have included at the end will give you kind of a lot of other suggested talking points that you can use. Reference your own experience. Again, you want to make it personal. You want to tell a story. Like I had this one patient who we struggled really to diagnose for, a week. And then, when we kind of made the final diagnosis, it was remarkable. It was such a rewarding experience treating them. Using stories is a very, very effective way of leaving a strong impression with your interviewer. I remember the stories my applicants, the applicants who I interview tell me much more than I remember the actual word for word, the points that they say. So stories are a very useful tool to use during your interview day. And avoid negative things. This is good advice. In general, you don't want to be critical of, the country you're coming from. You don't want to be critical of your medical school. You don't want to be critical of people you've worked with. In general, you want to speak positively and leave that, optimistic, positive, constructive impression. You don't say you want to do radiology because you hate meeting people and you like being in a dark room all day, or that you want to do surgery because you don't like rounding. I mean, obviously, if you say it as a joke, a clear joke, humor is definitely an effective tool to use. But I hear people seriously say these things, and that's not good. Still funny, but it's not good if it wasn't humorous intent. What are you looking for in a program? So when we ask people this question, what we're looking for is, do you have insight, as to what you think will help you get to where you want to be? What are you, are you seriously evaluating programs? How are you seriously evaluating programs? And the advantage of this is also where the interviewer can start selling the program to you based on what you're looking for. So now the interviewer is going to be able to start telling you, hey, this is what our program has. And again, this is a two-way street. The interviewer likes you. They want to start telling you about how good the program is. So don't use generics here. Don't use generics. And what I mean by that is, sometimes people will say things like, oh, I'm looking for a high quality training program. Well, of course you are. Everybody's looking for a high quality training program. Nobody's going to tell you our program is low quality. We can't help you out. The other thing is I'm looking for a program that will prepare me to be an internist or a general surgeon or a pediatrician. Again, like that's really the goal of every program, right? So to think about it more specifically, think about this question as, what do you think in the program will make it high quality? Or what is it that you think a program should have to prepare you to be a hospitalist, or to prepare you to be a surgeon, or to prepare you to be an internist or a pathologist or whatever? And you want to mention specifics. And again, I would always go for 3 because I didn't want to, bore my interviewer. But suggestions that you could, use: good exposure to diverse pathology. I want to see the common, bread and butter cases, but I also want to see uncommon things and rare things as well. I really value resident autonomy, and I like it when residents have the ability to make decisions and care for their patients the way they want and learn from their own practice. I'm looking for a program that has dedication to teaching both at the bedside and through like formal conferences and didactics. I really want a lot of hands-on experience, especially with procedures. This is key for applicants who are interested in, surgical programs. 100%. You don't want to go to a program that you're not cutting open patients and doing things in the OR until your second or third year. You want as much hands-on experience as you can as early as possible. But also, if you're interested in things like critical care, cardiology, those sorts of things, you want a program that lets you put in all these central lines, do all these procedures, intubate people. Looking for a caring environment and close resident class, research and teaching opportunities, if those are things that are important to you. And then I think very, very importantly, support during fellowship or job application. I think for me, I would regularly choose resident autonomy, research opportunities, and support during fellowship application. Those are things that I would regularly use. I wouldn't recommend that you use all of these, again, because you don't want to bore your interviewer. And this is when the interviewer, will start saying, oh, those are great points. Let me tell you how, we have all these patients who come from all over the country or all over the state with all sorts of diverse diseases and all sorts of rare conditions. And, you'll have a lot of research opportunities. I do research with the residents. We hook you up, and, we support people who are looking for jobs by calling hospitals. We'll call fellowship programs and tell them that you're a great candidate. This is again, how you want to give the interviewer the chance to tell you the strengths of their program. And if they lack something, then this is where some of them may be honest and tell you, listen, research is something we're still struggling with, and we're trying to hire people who do good research, or we're trying to hire statisticians. And that's important for you to know. That's important for you to know, especially if that's something that you think is very important for you when you're considering a program. Now, what do you plan on doing after residency? You don't have to have a plan that is like set in stone 100%. Like, I am going to do gastroenterology in the state of Seattle in this hospital, for 10 years. Like, it doesn't have to be that set in stone. But what we want to know is that you kind of have goals, and that you're thinking about your future seriously. So again, points to consider: do you feel like you're going to subspecialize, or do you feel like you're going to go and be like a general pediatrician or a general surgeon, and that's it? That's good enough for you. Do you want to do? And again, just a point that I want to make here, because I think this is a cultural difference, I think, between our background and the US. It is not viewed as negative to want to be an internist. Absolutely not. It is perfectly fine and perfectly appropriate to say that you want to be an internist, or you want to be a general surgeon, or you want to be a general pediatrician. Do not feel the need to say you want to do a fellowship. That's not how things are viewed here. An internist isn't viewed as any less of a doctor than someone who's specialized. And in fact, if you're interviewing in internal medicine, for example, most of the people in the program, the program director and the associate program directors usually are internists, primary care doctors, hospitalists. that's how most of the residency programs are becoming now. So don't feel the need to say, oh, if I say that I want to be an internist, they're not going to take me. Absolutely not. It's very likely the person interviewing you is an internist. And the reason I say this for two reasons. Number one is because don't feel the need don't feel the pressure to say you want to do a fellowship if you don't. And number two, you don't ever want to come across as being like, disrespectful of people who stay on as, internists. You don't ever want to say something like, oh, I could never be a general pediatrician. I need to subspecialize in this field. When the program director interviewing you is probably a general pediatrician. Same thing. You don't want to say like, oh, I could never be an internist. Of course, I'm going to, or, people don't usually say that they could never be a hospitalist, but what they will sometimes say is like, of course, I'm going to do a fellowship. And then you ask them, what fellowship do you want to do? And they're like, I don't know, any fellowship. It's like, well, why, of course, you want to do a fellowship? Just doing a fellowship isn't better than staying on as an internist or as a hospitalist. So that's I think a key point that I want to emphasize. There is nothing is not viewed as inherently better that you want to do a fellowship. And if you want to do a fellowship, you have to know what fellowship, or you have to have an idea of which one or two specialties you're interested in. Don't just say, oh, any fellowship, I'll just take anything I can get. No. You want to say, oh, at the moment I'm considering, rheumatology and endocrinology, or I'm going back and forth between doing cardiology or being a hospitalist. Other things that you can consider, do you want academics or do you want private practice? Is, things like other things like you want to help the underserved community? Do you feel like you want more of a leadership role? Do you feel like you would stay in the US, or do you want to return to your country? So for example, I can tell you, I had a applicant who's like, listen, I'm really interested in cardiology, but I want to do I want to become a cardiologist in the community and spend some time helping an underserved community in the US for a few years, but then I want to go back to my home country. He was from South America. He said, I want to go back to my home country and help my town because we're very underserved. We don't have any good cardiologists. And that's kind of my goal, do training here and then go back to my country. And he was an excellent applicant, phenomenal applicant, very strong application. And that's perfectly fine. And it's not like we're going to say, oh, you're going to leave us and go back to, no, it's great that he told, like, he's very clear about what he wanted. He wanted, to be a cardiologist, helping an underserved community, and then go back to his town to make an impact there. And that's perfectly fine. You can say, I want to be an internist in private practice. You can say my family, has a primary care clinic back in my, town or my city, and I want to, applicants say that. So again, I think the most important thing is you want to make it clear that you're thinking of several options. Don't just say, oh, I haven't really decided, and I'll see what comes up in residency and what I like. I would say have one or two things, say that I'm thinking about this or this, but I'm really, interested in exploring more during residency. I'm open to, obviously changing my mind in residency, but at the moment, these are the one or two things that I'm considering. Okay. Differences between the US and your country. This will typically be asked if you actually spent time doing electives or research or stuff like that in the US. And typically it's more questions about medicine and like the medical system, more so than the actual culture. Sometimes they'd ask questions about cultural differences, but usually it's more about the differences in the medical practice. And I think important, some points to consider. And again, my go-to was 3 points. I didn't want to bore people, but I also wanted to show them that I thought about this. So I think, the cultural attitudes towards medicine are different in the US than they are from other countries. Here, it's more of a shared decision-making model where you tell the patient the different options and the risks and benefits, and the patient picks what they want, as opposed to, many other places where it's more of a paternalistic model, and the doctor says, this is what, I recommend, and the patient says, yes, doc, and they do it. Obviously, the issue of insurance versus government-funded healthcare, resource availability. I remember when, back when I was a med student in KFSH, we were ordering MRIs a lot more commonly than we order them here. Because there's a lot of resources, it was government money, it was, fun, it was great. We could order a lot of testing. But here they have other things like more ancillary resources available, like social work teams, like nursing facilities they can discharge patients to, and that's a big difference. Resident autonomy, I really think that the, residents in the US get quite a bit of autonomy, which I think is a phenomenal part of the training. And I think there are more research opportunities and opportunities to teach medical students for residents here than there are in many other countries, at least based on, my discussions with people coming from other countries. Let's talk about your hobbies. This is, this should be the best part of the interview. This should be super fun. You should be willing to talk so much about your hobbies. I remember I had an interview. The whole interview was just, I had cooking as one of my hobbies. The whole interview was talking about cooking, different dishes we cook, different chefs we like to learn from or watch. And another interview, like half of it was like about fishing that I had in my CV as well. And they were talking to me about, the fellows having their own fishing group and things like that. So this really should be the chance for you to just talk and chat and speak a lot about what you like and what interests you have, and just be passionate and enthusiastic. It's very awkward when you ask someone about their hobbies and they just give you a 2-word answer and then they're just looking at you like, if you can't even talk passionately, if you can't make your hobbies sound interesting, then really, how fun are you? So really, this is, sometimes you ask people like one question about their hobbies and they'll talk for 2 minutes about it, and they'll be like super passionate about it, and they'll tell you everything they learned and some of the mistakes they made. And then others, it feels like you're just pulling a tooth out of them. Like, tell me more about this, tell me more about that. Like, why do you like this? Who do you like? What, it's don't make this awkward, but have fun with this. I do remember another thing, again, anything you put in your CV, you have to be ready to talk about. And I heard, you hear things about, people asking, interviewers asking applicants about, they put basketball or soccer in their hobbies, and then it turns out the interviewer is really passionate about it. And they'll ask them all these questions about like, oh, what team do you like? And who do you play? Who do you like? Who's your favorite player? Or, and if you're unable to answer those questions, that's really bad. That's bad. So don't put a hobby that you're not willing to talk about just so that you can impress people. I don't know anything about football. Some people they asked me if I knew anything about football, and I told them, nope, sorry, I'm not a football fan. I mean American football. And that's fine. I'm like, okay, that's fine, and then we move on to another subject. But if I told them, oh yeah, I love football, and then they started asking me all these questions about football, and I wasn't able to answer, that would have just been very awkward and reflects very poorly. Enough about that. Now, less common questions. Tell me about your strengths and your weaknesses. Tell me about an interesting patient. Tell me about a mistake you made. Really here, the point of this is to see how introspective you are. Can you self-reflect and evaluate yourself and know how to improve yourself? It's a little awkward to talk about your strengths and weaknesses. I think one of the approaches that I've found the most useful is to take it from almost like a third-person perspective and say, I've been told that this is one of my strengths, or I've gotten feedback that, I'm a great team player, and that's something that I really value and I appreciate, and I hope I keep that with me throughout my career. And that's really important to me, and it's something that I've worked on. I feel like that's a better way of saying, oh, I'm just super awesome. I'm a great team player. I'm very humble. All that sort of, I just like this approach better. I feel like it's a much more modest way of saying it. And whenever you can use an example or show something that you've worked on, use that, because it proves the point without, just you bragging. Same thing, like, feedback that I've gotten about things that I could improve on. I've been told that, I could improve, I can work on my presentation skills and improve my public speaking skills. And that's something that I've been trying to do. I've been trying to take more opportunities whenever I can to present publicly, or to present, on rounds, or to, share a PowerPoint presentation with my classmates or things like that. And I was just trying to get out of my comfort zone. That's a nice way of approaching it. Other weaknesses could be things like time management. Don't mention a strength masked as a weakness. This is something like, oh, I work so hard I lose sleep. That's not a weakness. That's kind of like saying my only weakness is I have no weaknesses. Don't mention a strength masked as a weakness. Mention an actual weakness, and always end on a positive note. Mention what you're working on and how you're improving that weakness and how you're trying to get better at it. Whether that's presenting more, whether that's trying to take notes during rounds and write everything down so you don't forget things, whether that's trying to time yourself when you're writing notes so you improve your time management skills. Just something that you ended on a positive note and how you're improving. Don't mention fatal character flaws. I think this is pretty obvious, but don't say something like, oh, my weakness is I'm a pathological liar and you can't trust anything I say. That's not a very smart thing to do. Tell me about an interesting patient. Again, this is more to hear you talk about something and to see, how enthusiastic you are and what you learned. This could be anything that, a patient that you had difficulty diagnosis, a patient you had difficulty managing, a patient who you had really interesting conversations with. What you learned from that. You learn how important it is to communicate well with other teams. You learn how, to review the literature for rare diagnoses. the importance of, being empathetic, whatever it is, just what did you learn from that? Same thing about a mistake that you made. This could be something that you forgot to do because you forgot to write it down in rounds, and you learn to just regularly write everything that's being brought up on rounds. Again, end on a positive note. Behavioral questions, I personally don't like these, but they do get asked every now and then. Again, really, questions like this would be things like, what would you do if you saw your co-intern struggling on rounds? Or how would you approach a coworker who you suspect is under the influence of alcohol? How do you receive criticism? Tell me about a situation in which you faced conflict, and many others. I think a few points to remember that help guide these answers is, first of all, patient care comes first. So if you feel like patient care is compromised, you want to step in and take action. Second of all, you want to always be empathetic and respect the confidentiality of your colleagues. Even if you think they're going to harm the patient, you will prevent them from harming the patient, but don't ever come across as judgmental. Don't ever come across as, like dismissive or like something that you would expose someone when they're vulnerable. Unfortunately, physicians using, substances, alcohol, other substances is quite common in the US. It's more common than people think it is. And it is possible that you'll actually encounter something like this during your training or at any point in your career. So being firm that you don't want to compromise patient care, but also don't ever seem unempathetic or that you're making fun of people or that you're judgmental. And then last but not least is the third point is always take it up the chain if you're worried about it confidentially. Always just take it up to your chief resident, ask them for help. So again, if you saw your co-resident is, you think they're drunk on a night shift, then you would, different people have different opinions about whether or not you actually talk to them about it, confront them about that, ask them like, hey, have you been drinking recently? I'm worried. And again, patient care comes first. So you ask them to kind of excuse themselves and to reach out to the chief residents and communicate with the chief residents that they need someone else to step in and cover for them. And if not, patient care comes first. You will confidentially communicate with the chief residents and tell them like that you're concerned that this co-intern is struggling with substance abuse or is currently under the influence, and someone else needs to come in and take care of their patients. Similar things, if your co-intern's struggling on rounds, you will ask them, what you can help them with. You will, carry one of their patients for them. You'll answer their pages for a couple of hours. You take the next admission. But again, if they're still struggling, you can always ask your senior resident for what else you could help them with. All the while being empathetic and respectful and saying something like, I know that I would want to be helped if I'm struggling, so I try to do that for others. Tell me about a situation in which you faced conflict. This could be something as simple as, there was a miscommunication between me and another team member, and it led to different, perspectives on things and different, things being done differently. But, we ended up talking about it. We ended up, communicating well, and I learned the importance of, clearer communication so that everybody's on the same page. Weird questions. These are questions that, like, if you could be an animal, which one and why? Or if you could bring one person back from the dead, who would you and why? I really think when an interviewer asks this question, they're bored and they're just trying to have fun with you. Have fun with it, say something crazy, like I'd be an iguana, I don't know why, or I'd be some weird animal, and just have fun with it. There will be questions that you get asked that you did not prepare for. That's fine. Be ready for that. Just be calm, be relaxed. Imagine that this is an interview or a chat you're having with some of your friends. What would you say to one of your friends? If they could be an animal, which one and why? If you could be an animal, which one and why? Obviously, don't say that's a stupid question to the interviewer. I know that's what most of us would say to our friends, but just imagine one of your friends asks you that and you're trying to answer that in real life. Don't let a bad interview drag you down. There will be you'll have interviews that don't go that well. You'll have interviewers who have, again, like poker face. They're really not giving you any positive impression whatsoever, very dry, and that's fine. Don't let that drag you down to the next interview. Reset after each interview, smile, take a deep breath, start the next interview. And people have matched at programs where they felt like they actually didn't interview well, or they felt like the interviewer wasn't impressed with them, and they ended up matching there. So don't let that drag you down. And obviously, this is pretty obvious, try to avoid any controversial political, social, or religious issues. Lastly, I think we'll talk about what questions you can ask the program. And if when an interviewer asks you this, they really want to, at this point, they want to sell the program to you, and they're shifting gears from assessing you as a candidate to now I want to sell the program to you. Avoid a generic question like, what are you looking for in an applicant? Again, I'm giving you 5 minutes for you to evaluate the program and see how you're going to rank our program and see what you're looking for in a program. What am I looking for in a resident doesn't affect your ranking of the program, and you're not giving me the chance to sell the program to you. So things you can ask about: figure out what's important to you. Is resident autonomy important to you? Ask about, how much autonomy do the residents get? Ask about the balance between clinical work and teaching. Ask about support for going into fellowship or looking for jobs. How do they support their residents? Ask about research support if that's something you're interested in. Just ask whatever you think is going to make a difference in your ranking, and people will be happy to talk to you about the program. This is really the point where I, as an interviewer, want to sell the program to you. So make use of that opportunity. Biggest advice: practice, practice, practice. Practice with friends, practice with a mentor, with a coach. Record yourself and kind of play it back and see how you're doing. Body language is extremely, extremely important, as I mentioned. Very important. You want to smile naturally. You want to have good eye contact, relaxed body language. Don't want to appear anxious, nervous, fidgety. Staring awkwardly at the camera for like the full 20 minutes isn't fun for everybody involved. And you don't want to come across as arrogant or disrespectful either. So you don't want to look like this on the right, but at the same time, you don't want to look too cocky like this on the left. You want to kind of have that perfect balance. You look relaxed, you look fun, you're having fun, you're smiling. People like being around you. Last, I think, key bit of advice: do not memorize your answers and try to rehearse them. That just comes across as very robotic, very scripted. My biggest advice with regards to this is just remember the 2 or 3 points you want to talk about. Don't actually remember the words in the sentences. Now, from our standpoint, what are we looking for during interviews when we're interviewing candidates? Again, typically, if you're being interviewed, we like what we see on your resume. We like your application. We like your CV. We like the work that you've done. What we're trying to assess when we're talking to you is, are you someone who we can trust? Are you someone who seems honest, hardworking, someone who's a really good communicator that patients would enjoy talking to and like talking to? Again, especially if you're in a clinical field, talking is really part of one of the most therapeutic things we do with our patients. So being able to communicate well is key. Someone who we think will go far in residency and beyond. And like I said in the beginning, if you leave the impression like, I really like that person, I really like talking to him, I think she'll be fun to have with us on a night shift when things are getting busy, she'll have that positive, optimistic attitude and keep us going when things are rough. That's really, I think, the best impression you can leave with your interviewers. Now, ranking, again, has both the application and the interview involved. And, people who have, again, typically, if you're being interviewed, then that means your application is good enough to be ranked. Obviously, still, people who have, a stronger CV, and if you have stronger letters of recommendation, that's going to give you more of an edge during the ranking. But then the interview as well can also give you a great edge, especially if you left a positive impression. I think a really good interview can make up or can help a average CV, but a really bad interview will just drag down even a brilliant CV. Like if this is someone who really does not communicate well, comes across as arrogant, that's going to drag down a negative CV. It's an interview can really, and that's really, I think, one of the biggest goals of the interviews is to kind of weed out these people who we really think don't fit well with us, don't communicate well, who we don't like their attitude. That's a big part of the interviews, just weeding those out. Quick comments on illegal questions. Things that like age, ethnicity, your marital status, number of children, plans for children, other programs, and how you're ranking them, religion. Those are questions that are typically not allowed to be asked in any interview in the U.S., I think. Unfortunately, a few interviewers will ask them, I think partly because they don't know that they're illegal. And when I've been asked these questions, I never felt like it came from a negative place, like, oh, this question is going to impact my ranking of you. It was more like, asking, hey, like, do you have any wife and kids? Because this city's really great for families. Unless, I'll tell you, I have a wife and kids, and my family here loves it in, Boston, for example. So that's really where that would come from. And I had no problem answering these. And again, I wasn't married and I didn't have kids, and that may be part of the reason why I didn't have any problem answering these questions. But At the same time, I really didn't feel like they came from a negative place. So I didn't take offense at these. And again, another question, for example, was like they start talking about how much they love the city, and they start talking about the bars in the city and the beers, and then it would kind of click in their mind, like, oh, wait a minute, and then they'd ask, are you Muslim? Like, do you drink? Again, technically this is illegal, but I think it was more of coming from a place of like, oh, I want to tell you how great the program is, and then oops, I'm sorry, I realized I might have said something that you don't, that goes against your religious values or something like that. So again, I always felt like it came from a good place whenever these questions got asked. But be prepared for them. Have an approach on how you want to address them. For me personally, like I said, I had no problem answering these questions. I never felt personally attacked or anything like that. Other people would say, no, I don't, like these questions, and they would try to circumvent it. They would try to say something like, hey, I'm just at this moment, I'm really just focused on trying to get into the best residency program. I'm not really concerned about anything else like marriage, or I'm not, my focus at this point isn't, family or whatever, however you want to phrase it, just phrase it in a way like residency is like my biggest objective at the moment. Other people would take a more direct approach and ask questions back like, oh, like, why is this important, or how is my answer going to be used, to impact my ranking? Some people would frankly say, hey, this is, a question, I'm not sure if you're aware, doctor, but this question is not, you're not allowed to ask this question during the interview season. Different people have different methods of approaching this. So I guess just prepare. I got asked at least 3 or 4 times during the interview season. And again, I felt like it was more like because they didn't know that they shouldn't be asking these questions. Post-interview communication. So we'll breeze through this. This is now after the interview day, of course, and what to do after the interview day. This, inshallah, won't take too much time. So sending thank you emails. If the program discourages it, don't do it. Don't send it. If they have on their website or they said something like this during the interview day, just don't send it. If you do send a thank you email, please avoid any spelling or grammatical mistakes, and please write the correct name of whoever you're thanking. It's happened where people put the wrong name, and sometimes for a different program director. Very awkward. Don't do that. Make it brief and add something specific about the interview so they can remember it by, like, dear so-and-so, thank you so much for taking the time to interview me. It was great meeting you. I really appreciate you telling me about the program. I particularly enjoyed talking with you about this. I really enjoyed our chat about that. Whatever it is. Everyone I met was really nice and helpful. I'm very impressed. I would love to return to ABC and work with you all in the future. Do I think it really makes much of a difference? Probably not. But I personally like doing it because I felt like it was respectful and polite. Now, after you're done with interviews, this is where the ranking and matching magic happens, the NRMP. This is how the website looks like. You log in, and then you start ranking your programs on that site. How you should rank programs really depends on what you value. Things you should consider, like the culture of the program, the environment, how happy are the residents there, the dedication to resident teaching, the workload and the support. Resident outcomes, I think, is key because, again, residency is a temporary job. You're there for like 3 to 5 years, I think 7 if you're doing neurosurgery. But look at where they go after they finish their residency. Look at where they end up for fellowship. Look at where they end up for jobs. Look at research opportunities and the research output. Look at their board pass rates. The city is very important, and it's not just that the city you'll be living in is very important, but people tend to stay, it's very common for people to stay locally for jobs or fellowship, if not in the same city or state, in the same region. So people along the East Coast will stay along the East Coast. People in the South will stay in the South. People in the Midwest tend to stay in the Midwest. So the region, I think, is important. It's not always the case. People often, transplant from one side to another, but it's far more common for people to stay in their, same region. Salary and benefits, obviously, these are non-negotiable. They're fixed. The program tells you what it is, and that's what it's like, so you can't really negotiate these. I have to say this because I've been hearing questions about this coming up from Alfaisal students in particular. Do not use online reputation lists to rank programs. I don't think anybody seriously uses these to assess the candidates that they're evaluating. Now, obviously, there are programs that have strong reputations, and there are the Ivy League programs and things like that. But again, nobody ranks them down to that minute level that these reputation lists, like Doximity, for example, has a list. I mean, first of all, that list is like Doximity is like a social media website for physicians, and I think only a few thousand probably have. I actually don't know how many have accounts, but it's and that reputation list is based on like voting by these physicians who have this account. So it's kind of like a Facebook poll, which isn't the most reliable first of all, to determine the reputation, and second of all, like nobody I know uses that here in the US. So yeah, don't use that, right? Just keep in mind, you want to know where the residents are. Will you end up being here if you join the program, or will you actually end up being on the front lines? Will you have autonomy? Will you have, the ability to do procedures and surgeries if you're in a surgical residency? Will you have the ability to make decisions and lead rounds if you're internal medicine or pediatrics or family medicine? And I mean, honestly, in my opinion, these are my favorite types of teachers, the ones who are really there to support but are hands off, sitting in the back. I mean, a program that has these types of faculty and these types of mentors I think is the one that you will really grow in the most. I have to say this every year, and I'm surprised that something this common is still not known to everybody. You rank based on what you want the most. Don't rank based on where you think you are most likely to match. Don't say, oh, this is my favorite hospital, I would love to go there, but it's super competitive and I don't think they're going to match, they're going to rank me high enough to match, so I'm not going to put them as my number one choice. That's not how the ranking works. Even if you don't match at your number one choice, that has no impact whatsoever on your second choice, your third choice, your fourth choice. So really rank, that the algorithm favors your ranking. So rank based on how you want your list to look like and what you want the most, even if you don't think you have a high chance of getting there. I have to say this every time. I'm surprised at people who say, oh, I really love this program, but I don't think I'm going to match this, so I'm not going to rank it my number one choice. Terrible idea. Terrible idea. Finally, I think communicating with programs, your ranking, your intent to rank them. Differing opinions on this. Personally, I didn't do this because for a variety of reasons. I don't think it helps much, and at least for the programs that I was interested in. And I can tell you from this side of things, ranking is a very complex process with multiple people involved, and I'm not really sure communicating your ranking interest is going to have that much of an impact. However, I know programs, and I've heard from residents that the programs they're in really like it when someone tells them that they're going to be their number one choice. So this is obviously, I know this isn't true for everybody. Again, basic rules. If a program discourages it, don't send it. If you tell a program they're your number one choice, you better rank them number one. You don't want to lie. First of all, it's haram. Second of all, medical circles can be very small, and you may end up encountering the people you lied to down the road in your career, and word can spread. Word can spread, especially once you start talking about like even smaller and smaller subspecialties, like a fellowship subspecialty or one of those smaller surgical subspecialties. Word will spread. These people talk to each other. So you better rank your number one choice number one if you tell them that. If you tell programs you'll be ranking them highly or they'll be among your top 3 programs, we all pretty much know that means we're not your number one choice. So people send it. I think it's nice, but ad tells me we're not your number one choice. If someone within the program, again, tells you that the program really likes it and really values it, then send them a letter. And if you do send it, again, avoid spelling and grammatical mistakes and avoid the fatal mistake of writing the incorrect program director name. Terrible idea. Finally, the SOAP. This is the Supplemental Offer and Acceptance Program. We're not going to spend too much time here, but really, Monday of the match week, you'll know if you're matched or unmatched. Inshallah, all of you who apply will match. But those who are unmatched, you can participate in SOAP. And basically, this means that this isn't the end of the line. This is a very nice backup program that the matching system has. So when you go, if anybody goes into SOAP, what they'll see is the list of unfilled programs that have open spots after the match. And then the applicants can apply to these programs. Within 24 to 48 hours, the program directors will start calling them and trying to do interviews with them either over the phone or virtually. And then there will be several rounds that happen during the week where program directors will send offers to the applicants, and the applicants can choose to accept or reject. If they accept, that's it. It's like pretty much you signed a contract with the hospital, you're going to be one of their residents. And if an offer doesn't come or the offer is rejected, the second round, maybe another program will send an offer or not. But that's how pretty much the SOAP works. I don't have as much knowledge in this, but there are a lot of references online and YouTube videos that explain it very well. Inshallah, none of you will need it, but I've known several people who've matched into programs this way and who've liked it and who've who've liked their programs and who've gone on well and been successful in their residency and beyond. So I think this may actually be quite useful this year because I have a feeling applicants are interviewing virtually at more programs than they usually do, but they're only going to match in one program at the end. So I have a feeling there will be quite a few unfilled spots this season. I don't know. That's my prediction. We'll see how it plays out. If you don't match, don't give up. I know people who match in their second round. I know people who match in their third round. Review your application, get an objective opinion, get second opinions, get more experience and more achievements, boost your application. Next year, consider applying to more programs, and always have a backup plan. Number one, because obviously you want to have something to do when you're applying for the match. This could be research, this could be a TA position, this could be doing a master's, for example, or doing a clinical job. Do something, add something to your CV, and do something in this time. Not only does it help your CV, but I also think that it's useful to explore other avenues. And what I mean by this, I really think that, especially in Alfaisal, we have this culture that the only successful outcome is you finish med school, you have to apply for residency, and you have to do residency, and you have to, match into residency and do that. When really medicine offers you so many more opportunities, and I think closing those doors and locking them is not a smart idea at all. And I've known several people who do these things even before applying to any match. They work as a research assistant or a research fellow, or they do a master's, and they end up really loving it. And they end up changing their plans, even though they did the USMLE and everything like that. They end up changing their plans, and they end up pursuing a PhD or doing more of a teaching role. So again, that's one of the beauties of medicine, is you can choose other options other than just going into residency. And people often figure this out from their backup plans. And that was it, I think. So these are the recommended resources. Sorry, I know I took a little longer than I had planned. It's 11:30, but we'll give time, inshallah, for everybody to ask questions they have. Recommended resources. This is the booklet that we wrote back in 2018. I think we can share it for people who don't have it. It's on our Facebook group. It's a little outdated, obviously. 2018. That was way back before COVID was a thing. Way back in the day. The Successful Match 2017. This was my favorite book when I was applying to the match. Again, a little outdated. I actually don't know if I have an updated version, but very useful. The First Aid for the Match was nice. Not as good as the Successful Match in my opinion, but I really liked it. This video library was absolutely phenomenal. It's by the University of Wisconsin, and they have all these great videos about how to approach, the interview season. I love it. It's one of the best resources I think I had during the interview season. Obviously, the ERAS website, the NRMP website, great resources. You should obviously be using them if you're applying during the interview season. For those of you who are interviewing now, please make sure you've signed up on NRMP, you have your NRMP number, and put that on your ERAS account. That's I think that's pretty much it. Thank you very much, everybody. Thank you for listening. Sorry, this for those of you who stuck around to hear me chatter on for 90 minutes, I appreciate it. Anybody who wants my email, the international office, Aisha, Ala, and any one of you, you can all share it with the people who want it. You guys can also find me on Facebook. I recently have started a Twitter account too, which I'm now regretting, but at the moment I am available to be reached out through Twitter. So any questions, you guys can please feel free to reach out. You could also unmute now and ask questions. I'll be available to answer any questions here. Okay, we're starting to get some questions. Thank you guys. Appreciate you saying that. That's very nice of you. Muhammad, great talk. Thank you so much. Thank you. I heard that some programs might reach out to applicants saying they will rank them highly. Oh, that is true. Programs. So again, keep in mind, this is a two-way street. Programs very often reach out to applicants and tell them, hey, listen, we really like you and we're going to rank you high enough to match. And this happens. This happens very regularly. And obviously it's a very good sign. Inshallah, all of you will be getting emails like that. I think, again, if they're your number one choice, that's perfect. That's perfect. That's like best case scenario. If they're your number one choice, you respond, thank you so much. That means a lot to me. I have to tell you, you're my number one choice. And I really, am excited, and I really look forward to working with you all. That's best case scenario. If they're not your number one choice, then this is when you be a little more generic. Thank you so much. That really means a lot to me. I really appreciate that. I had a wonderful time interviewing with you, and I really loved your program, and I know that I would be very happy working with you all as a resident. And again, you want to be very polite, you want to be very enthusiastic, but you never want to promise something that you're not willing to commit to. So, things like, I really loved your interview day. That means a lot to me. I would love to work with you all. I know your program has what I'm looking for. And thank you again, I think is a good way to respond. But again, part of professionalism and honesty is don't tell them like they're your number one choice if they're not, and don't ignore them either. Even if they're the bottom of your list, don't ignore people. That's just rude. Okay, question anonymous. How do you address red flags in the MSP? Academic failure, repeat any disciplinary offense, provided the person reaches the interview has worked hard. Okay. So, good question. How do you address red flags in the MSPE? Thank you actually for asking that question. I should have thought of that. Or anything in the application, red flags in the application. So this is a good question because, again, if you are being interviewed, the red flag wasn't enough to discourage them from interviewing you. And I would be, so there's two general strategies of this. One of them is to be proactive and to tell the program like, hey, I overcame, like, again, keep in mind, you want to have several points you want to talk about during your interview. Again, for me, like, it was talking about my background, what I'm currently doing, my interests, things like that. If some people say one of the points that you really want to try to come across in your interview day is to bring this red flag up and tell them, how you improve and what you learn from it. I'm not particularly fond of that strategy. I think if that works for you, great. But again, if the program has thoroughly reviewed your application, the red flag wasn't a deal breaker for them. And if they want to know more, they will ask you more. Second of all, you don't know if your interviewer actually knows about the red flag. And again, I'll tell you, programs will sometimes keep things hidden. Like, programs don't always share everything about your application with the interviewer. So that's the first thing. Programs often, like, for example, many programs will blind their interviewers to the USMLE scores. So the interviewers don't know the actual USMLE scores of the candidates they're interviewing. And if you think your score is a red flag and you bring that up to the interviewer, and the interviewer is like, oh, I actually didn't know you had a terrible USMLE score, let's talk about it. That's a very awkward, situation. So another thing is, one thing is the programs may not all share all the information with the applicant, with the interviewers. Some of them actually blind them completely to the CV. I've heard, and it seems like this is actually quite common in pediatrics, it seems, where they will really like blind the entire CV to the interviewers, and they'll just share like the personal statement, for example. And then they really do it just so that the interviewer only is getting to know you as a person more than anything else. So again, they may not know about the red flag. And the other thing is, and you will come across this, is not all interviewers review your application thoroughly. Not all interviewers review your CV thoroughly. And again, you don't want to bring up a red flag that they didn't know about. So my advice is be ready to talk about it. Have a good response prepared on what happened. Don't make excuses. Just say, you know what, this is what happened. This was my circumstances, and I think I know why this happened. This is what I did afterwards, and I think it's helped me grow and helped me learn. But it is definitely something that I still regret, and but I've overcome this, and end on a positive note, like I said. But my opinion is don't bring it up yourself. That's other people may disagree, but that's what I think. Okay. I see. Hey, great talk. Thank you, Sid. If we don't match, how do you recommend we add preliminary positions? Oh, very good question. If you don't match, recommend preliminary positions. Very good question. So it depends. So keep in mind that traditionally the preliminary spots are usually for people. So let's divide it this way: preliminary internal medicine and preliminary surgery. So preliminary positions are usually for people who want to do one of the more advanced residencies, like ophthalmology, radiation oncology. They generally, or neurology, for example, those programs require a year of either preliminary medicine and preliminary surgery to do that. Most of them generally pick preliminary medicine for obvious reasons. That preliminary internal medicine is actually quite competitive as a result of that. Now, if there are spots available and you're interested in internal medicine, I think it's not a bad idea to apply to one of these preliminary spots available in the SOAP. But you want to make it clear that you're doing this because you're interested in medicine, and they don't care because it's a 1 year spot, right? And as long as someone is filling that 1 year spot for them, then that's great. The one thing you may want to keep in mind is that you will have to interview while you're an intern, which can be challenging. But again, it will be much better. I think it will definitely improve your chances of getting more interviews and matching afterwards if you do a preliminary year as an intern in internal medicine. And not only that, you may actually be able to, another option, if you don't match when you're applying as a prelim as an intern, you could potentially actually go to another program as a PGY2 after you've done with your intern year. So let's say you do the prelim intern year, you applied for the residency match, it still didn't work out again because maybe you've only been working again by that point for like 2 or 3 months. You probably don't have that many letters of recommendation. So, maybe it didn't work out. Hopefully it does, but if it doesn't, you may still be able to actually work because people change a lot in medicine and they leave residency programs. It's not very common, but any program that has like 20 plus or 30 plus residents will every now and then lose a resident. A resident who will leave to go to another program, who leaves medicine entirely, a resident who switches to another specialty. So you could potentially go in as a PGY2 after your prelim year as well as another backup plan. So I would say that is, if that's available, then great. Preliminary surgery oftentimes has a lot of spots available, and those are still somehow very competitive. And they really generally take people who are only interested in surgery, or people who want to go into one of those, who are competitive candidates who want to go into like neurology or radiation oncology or stuff like that. But keep in mind, preliminary surgery can still be hard to get into, especially if you have no interest in surgery. And it can be very busy, and it's maybe hard to apply to programs and interview during that time. And again, you'll have to explain why you want to switch from surgery to something else. But I say, again, preliminary medicine is very competitive, but if you're interested in medicine and there are spots available, go for it. How do you approach an interview at a recently accredited program where there are no prior? That's a that's a good question. I never thought of that, actually. How do you approach an interview at a recently accredited program where there are no prior residents? I don't know. I guess there's no way to avoid the fact that they don't have residents. So I think the question to ask them would be more about future plans. What are your future plans to support residents who are interested in jobs? Do you think there'll be job opportunities at your own hospital? Do you think there are opportunities to to support residents who are interested in fellowship? How do you plan on receiving resident feedback? How do you plan on giving feedback to the residents? That's very important as well. So all these things, I think I think it would be more questions of future questions, like how do you plan on doing this? How do you plan on doing that? I think especially support for jobs and fellowship is a very important thing to ask. It's a very important thing to know. I know it may be an awkward question to ask them, but honestly, if they don't have an answer to that, that's concerning. That's a red flag. A new program should be very enthusiastic about discussing their plans of how they're going to support their residents. Again, how are you going to give feedback to residents? How are you going to take feedback from residents? I think those are all important questions to ask a new program that's just getting started. Thank you, Mohammed. Mohammed has a great point. If I may interject, a few neuro programs are popping up now, and I found it helpful to see where leadership. That's actually a great point. I didn't even think of that. Where the leadership came from, and if they are influential in the field. Yes. So where the program leader, because obviously the program leadership will probably be people who have been in the field for a while. So you're right. So looking at where the program director came from, but again, this is probably something that would be difficult to ask in an interview. This is probably something you would review before the interview day. Looking at where the program director came from, what their background is. Maybe they'll be able, if they're coming from a big institution, that's a reputable institution, obviously their name will carry a lot more weight that way, especially if they came from an institution that worked with residents before, or if they were a former program director at another residency program, because I know that tends to happen, is hospitals will recruit program directors from other places to start a new program there. So if they were a former program director at a
good program, good academic program. The residents there did well. That's obviously a more positive, indication of the quality, both of the leadership of the program and hopefully where the residents will end up afterwards. Thank you, Mohammed. That's a great point. Any other questions? Feel free to send them to me privately in the chat, publicly in the chat. Send them, you open up your mic and ask questions so we can hear a voice other than mine. We'll give everybody a minute until it's 45.
Thank you so much, Dr. Khalid. Thank you so much for the wonderful presentation. It was indeed very beneficial, and we truly value your experience and your guidance. And I'd also like to thank AMBOSS for their constant support, and everyone in the audience, thank you for joining us today. And our team hopes that you found this session as informative as we did. And if you have any more questions, just please feel free to put them in the chat now, or you can unmute yourself and ask your question. Also, make sure to follow us on our Instagram and our Twitter handles, and subscribe to our YouTube channel to receive the latest updates about all our upcoming events. I'll put the links in our chat.
Thank you, Ali. Thank you, Shamil. Thank you, Suzanne. Appreciate it all. Thank you, Nida. Thank you to all the organizers for helping out with this. It's 45, going once, going twice. No questions. Okay, anybody can reach out to me with any other questions.
If you guys have any further questions or you'd like to contact us in the future, you can also do that using the link that I'll send now. And thank you, Dr. Khalid, and to the audience once again. And we hope to see you again in the future. Wishing you all a great day ahead.